welcome back to my YouTube channel. Today I'm going to start a new segment discussing my master's in public health. So many people have been asking me additional questions, so I thought it would be cool to have this series. In today's part, which is part 1, I'm going to be talking about 5 different ways I've used my master's in public health in the workforce, and then part 2 I'm going to be talking about what public health actually is. So let's get started. Well, most of you know I'm already in regulatory affairs, and during my master's program I worked in regulatory affairs the entire time. So one way that I've been able to apply what I've learned in school is honestly in my everyday work. So the best example I could give is the European Medicines Agency, also known as the EMA, often will ask you questions after you submit your initial application, which is called an MAA, a Marketing Authorization Application. So after the company I was working for submitted our MAA, we received day 120 questions. And in those questions, they kind of want to get a better sense of what your application is about, or get answers to any discrepancies they felt were there. Having my master's in public health really allowed for me to answer some of those difficult questions, or just simply provide support to answer some of those difficult questions. So when they're asking biostat questions about the different methods we plan to use, I think back to my master's program and I'm like, oh, I actually know what some of these methods are. It's easier for me to better answer some of those questions. Even though we had a biostatistician answering some of them for us, it was still nice for me to be able to understand what was going on and provide that additional support. The second time I was able to really use my master's in public health, I made brochures touching on sickle cell disease. During my undergraduate years, I focused a lot of my energy towards researching sickle cell because I am a carrier of the trait, and a lot of people from Nigeria, which I'm Nigerian American, suffer from sickle cell disease. So I made educational brochures for patients, for healthcare providers, different types of people just who wanted to learn about sickle cell disease. Having my master's allowed for me to better understand how patients view and receive information, how providers view and see information, as well as how caregivers view and see information. It allowed for me to create those educational pieces, which is one thing you really get to do with your master's in public health. Thanks for watching this video. Make sure you subscribe. The third example for using my master's in public health is in step 2, or number 2, I talked about making sickle cell brochures. What I actually ended up doing was I held a focus group and I had patients review the materials, and I was able to absorb how they felt about the materials I made, and I incorporated a lot of changes as a result of how they felt. It's still a way I was able to utilize my degree because we learned about hosting focus groups during my program. Number 4, when Nipsey Hussle died, my colleague and I, we decided to create mental health brochures. I got some information about where people can find help in South Los Angeles, or just Los Angeles in general, a few facts about Nipsey, and then a few more tips about how to grieve. So at the time, we took those brochures, packaged them in little bags, and put a candle, but just little things to help the community grieve better during that time, because it was a really big loss, and I was actually really affected by his passing. That's another way I was able to use my MPH, is I recognized that a community was in pain. And one big thing about being a public health professional is it's your duty and responsibility to tend to your community. And I am a Los Angeles resident, born and raised in Los Angeles. So for me, losing a figure such as Nipsey, who was also a huge advocate for public health, was important that I give back as well. Having your master's in public health gives you a different perspective on life. And I think it also teaches you empathy and compassion on a different level, to the point where you're not just expressing empathy, but you're actually putting that to action. Last but not least, the fifth notable time of me using my master's was for hosting racial discussion and being a facilitator of those discussions. For the current company I work for now, you all know what's going on in the world with Black Lives Matter and police brutality and all these racial injustices and inequities that are finally coming to light and getting a little bit more attention. I felt it was important to bring that to my place of work. So I've been hosting racial discussions and talking to people about the social determinants of health, about racial injustices and inequities, about how they can start the conversation about race with other people, their friends and family. And without my master's in public health, I would not be able to have those conversations. I would not be able to fully understand how living in a different community can affect your health, how living in, a lot of people know Beverly Hills, but living in Beverly Hills allows you to live 20 years longer than living in South Los Angeles. Thank you so much for watching part 1 of my little master's in public health series. Can't wait to come to you with part 2 on what public health is. Thanks for watching, guys. And if you're not subscribed already, come on, hit that button.